Doc is In is sponsored by Amada Senior Care.
Fox 56 News Chief Medical Contributor Dr. Ryan Stanton is with us in studio to discuss something not so fun, skin cancer.
Well, it's not so fun, but it's something that most people, a lot of people in this country are going to experience at some point. It is skin cancer. Skin cancer, predictions are that it's diagnosed between 10 and 15,000 times a day here in the U.S., with upwards of 5 million new cases every single year. And as of about 2 months ago, I was one of them. And coming up Monday, we'll have one of the most common procedures that's used to treat that. Skin cancer is the most common type associated with sun exposure, certain types of skin tones, and sometimes they just happen. Most of them are going to be a basal cell or a squamous cell carcinoma, which tend to grow slower and have great prognosis, but especially if caught early. Now, the best treatment, that's the most common treatment that's used now, is called the Mohs procedure. This is the one that's going to happen to me Monday. This is where they take subsequent layers of skin until they get a completely clear margin. A clear margin meaning they've removed all of the cancer cells. This helps preserve as much tissue as possible while leaving as little scar possible. Now, a lot of this has to do in terms of how far you have to go in terms of when it was caught, identified, and treated. The key for most people, and in my case, was the fact that a suspicious lesion, an area that started bleeding just a little bit off and on and would not heal. And unfortunately for that, we had them biopsy. It's going to be a basal cell. We're going to have the procedure done, but the most important thing everybody can do is make sure that you get your screening done as much as possible, especially if you notice something different. If there's a wound or a lesion, a mole that changes this area of skin that will not heal, get it checked out. If you've had a lot of skin exposure or a family history, which is what my family has, making sure you get into your dermatologist, get it checked at least once a year, get a skin check, catch it early, and get it done. That last picture is what I'm going to look like Monday afternoon on the computer with my nice big bandage on my nose, hopefully basal cell free.
You seem relatively calm with all things
A lot of
considered.
things could be worse, and the thing is, I'm the last of my family, parents, siblings, to be diagnosed with a skin cancer. So I knew it was coming at some point. With the number of years that I've been outside in terms of swim teams and yard work, and now with motorsports, you know it was coming. So the key was caught it early, had an idea, going to get it taken care of, and that's what I want everybody to do, because 10 to 15,000 cases per year in the U.S. is a lot of people.
I have an appointment. I'm a dermatologist for a body scan in 2 weeks.
Yeah, let's take the whole news team in Monday morning. We'll
And
just
then
get it all
everyone
taken
gets
care of.
spray tans like me instead of going to tanning beds or sitting out in the sun.
Yeah, once the weather starts cranking back up, we will definitely have conversations on that skin care and why spray tanning is much safer than dermatologists in terms of taking care of those cancers.
All right, Doc, thanks so much. I'll be right back after the break.